Dr. Rajesh Parikh of Jaslok Hospital is joining us as well. Dr. Parikh, thank you so much for speaking to us. This issue of vaccine hesitancy, the fact that, both in Maharashtra and Tamil Nadu, we have the data here, but this is the case even in other states as well, where a large number of people have missed out on their second dose. They've missed that window. What do you think it is, the main reason is? Because if we were to talk about vaccine hesitancy, they've taken their first dose, but they're not coming out to take the second dose.
Well, I'm not sure what the reasons are, but I think we could hazard a couple of guesses. I would like to believe that the main reason is complacency. People believe the worst is behind them, particularly with the recurrent usage of the words mild variant as far as the Omicron variant is concerned, and people being assured that this too will pass very quickly. It's possible, though, that the second reason is also the amount of false information that is being circulated everywhere. In fact, it's a sobering thought for us to remember that 2 years ago, within a month of the pandemic starting, the WHO had already warned of what it called an infodemic. And at that point, which I think was either February or early March 2020, they said that this infodemic was as dangerous as the pandemic in terms of the health of all of us. And we can clearly see this going around. I mean, the latest, of course, was the very public scandal that occurred with the Australian Open and Novak Djokovic. So there is a mushrooming body of anti-vaxxers. And what I think they fail to understand is that they are harming not only themselves and their immediate families, but they're harming society. I once used the word, bioterrorists for them, because, like terrorists who spray bullets with an AK-47, they are spraying viruses at all of us and endangering everybody around. I think these are the two main reasons, complacency and anti-vaxxer movements.
Yes, absolutely. And Dr. Parikh, coming back to you, so obviously that is one other issue, because there are a lot of people also who say, that I've already received one dose, why should I need to go and take a second dose, possibly not realizing what the implications of that actually are. If you can throw some light on that aspect, what it means when you just take one dose and don't take the second dose.
I do that. I just managed to find some charts which I was using in an update of our coronavirus book, which we wrote 2 years ago. And, they say a picture is worth 1,000 words. If your cameraman can pull back, I'd just like to show you charts which speak for themselves.
Okay.
This on your camera.
Dr. Parikh, I don't think we'll be able to see the charts.
Don't worry. So I'll just summarize them. I'll summarize them.
Yes.
The Municipal Commissioner of Mumbai,
sure,
Mr. Chahal, released a week ago that 96% of beds requiring oxygen in this current wave are occupied by unvaccinated people. And then I have another chart, and I don't know if this can be seen, but what it essentially says that in the past 11 months in the city of Mumbai, there have been 4,575 COVID-19 deaths. 94% of these deaths are in those who have been unvaccinated. If that doesn't persuade people to get vaccinated, I don't know what will. And of course, your question, I think the data is amply clear. From the times of the Delta wave, it was seen that people who have had a single dose are about 39% protected against the virus. People who've had 2 doses are about 70% protected against the virus. And people who had a booster, the immunity protection goes up to 95%. This, of course, was data from one vaccine. It varies from vaccine to vaccine, but with minor variation, it's more or less the same story. The second dose almost doubles the immunity provided by the first dose, and the booster enhances it too. And it's very, very important to get the second dose. I'd just like to reiterate it. You're doing it not just for yourself, you're doing it for your family, you're doing it for the elders in the family, you may be doing it for the children. In the current wave, pediatric bed occupancy in the United States has gone up by 50%. So you may be doing it for little children, and you certainly are doing it for society and for the country. Please take the second dose if you haven't already.
Right. Yes, absolutely. Dr. Parikh, this also leads to another point that our reporter was also talking about in Tamil Nadu specifically, where the data has come out of, where booster doses also, don't seem to be picking up. The very, very small percentage of people who've actually come out to take booster doses of the eligible population, just a few percentage of people who've actually come out. So obviously that is also another issue at this point in time.
Absolutely, and unquestionably so. I entirely agree with everything Dr. Bagai said. He brought up several points. I'd just like to reiterate a couple of them. One, it's not just about death. It's also about occupying hospital beds. People are getting permanently disabled as well. It's about oxygenation. It's also about infectivity. How quickly do you spread the virus? He told us that there was an R naught of 12. To just illustrate that, at an R naught of 12, which means 1 becomes 12, becomes 144, and so on, it's less than 20 steps from here to the moon. So that is an enormous number, an R naught of 12. And it is very important for people to get vaccinated. As to the boosters in Tamil Nadu, I think the government must amplify all of its methods to persuade people to take boosters. And something else, we have been a bit behind the curve. In the first 9 months, we were exporting vaccines. We started giving vaccines to our people a bit late after other countries had done so, only when we faced the enormous wrath of the second wave. There has been some hesitation also in terms of allowing boosters to come in, of allowing other vaccines to come in from all around the world. So I think we need to work at all levels. I'm not particularly happy to just be lecturing people saying, go get it done. I think the governments at the state and central level also need to do a lot more to facilitate the availability of boosters. And finally, if people are not availing of these boosters, say in Tamil Nadu, and I believe there are a couple of other states where that's happening too, why not give them to the people who are more than willing to come, but are being told that they're not eligible just because, they're not healthcare workers or they've not crossed 60. So I think the idea should be to administer these vaccines to as many people as quickly as possible, always keeping in mind that it is also a social campaign and not just a medical campaign.